The injury we'll be addressing today is the hip labral tear, also known as the cartilage fossa tear. This injury is commonly found in dislocations of the hip joint or instances of trauma to the hip joint. You kind of see prevalence for this type of injury in contact sports such as football, hockey, rugby, and even ballet, which is quite interesting. The signs and symptoms include locking, clicking, and catching. You'll probably experience some pain in the hip or groin region, some stiffness, and limited range of motion. You also might experience some pain with flexion or extension and pain while sitting and standing. Another kind of idea that's interesting with this injury is sometimes it doesn't show signs or symptoms right away, but it progressively gets worse and you will notice those eventually. So, that's what happens with it.
The prognosis for hip labral tearing is dependent on the severity of the injury. Recovery is also dependent on damage to the tissue. Dislocations from car injuries may have different damage to the tissue than those from impact sports. There are two grades of tearing, type 1 and type 2. For either tear grade, the athletic trainer will need to refer out most likely. The patient will need surgery For arthroscopic surgery, it is a 12 to 16 week return to play. Also for repair surgeries, there is a similar return to play time period of 12 to 16 weeks. For those that do not have surgery done, there is an unknown recovery time. Return to play is determined with the absence of pain and full range of motion within the patient. Short-term care is ice to the hip groin to reduce inflammation along with NSAIDs such as ibuprofen and aspirin. Also rest until further instruction is obtained from healthcare professionals.
Specific long-term care of the hip labral tear would be physical therapy and arthroscopic surgery. And for arthroscopic surgery, it depends on the quality of tissue at the time of surgery to determine what type of surgery is needed. The surgeon may be able to remove the torn piece of the labrum or repair the tissue. Another surgery would be to repair the associated structural problems. Some of the injury prevention methods would be conditioning the surrounding muscles with strength and flexibility exercises, strengthening the lower body, strengthening muscles that support the hip joint, as well as evenly balancing out your weight by staying flat on your feet instead of putting more weight on your toes or on your heels.
There are many strengthening exercises that can be used during rehabilitation, and these are mainly non-surgical, and they include rest, activity modification, oral anti-inflammatory medication, and also physical therapy. The purpose of this rehabilitation is to optimize sagittal balance with the thoracolumbar spine and also the pelvis. And this improved strength and flexibility can drastically improve healing after surgery if it is required or needed. So rehabilitation should focus mainly on the pelvic tilt, and this can be accomplished with exercises that include gluteus maximus activation, transverse abdominis and rectus abdominis activation, abductor control, rectus femoris, adductor and iliopsoas stretching, and also core control and pelvic floor control.
Here's the example of the piriformis stretch. You will get on the ground like so. You will get in this kind of position here. This is the side you're trying to work, and then you can just hold it for 30 seconds, do 3 sets, and it'd be good for some rehabilitative purposes, so go for it.
Part of rehabilitative strengthening with the hip labral tear is going to be balance exercises. One of the most common exercises that your athletic trainer or physician is going to recommend is your Sharpen Romberg, which is going to be a heel to toe stance. You're going to try and stand for 30 seconds, and after that 30 seconds is up, you should feel a little weak. You can alternate, do the other side for prevention purposes of other injuries because the hips work together, and you'd want to do that 3 times a day for about 30 seconds.
One of the physical therapy exercises of hip labral tear would be mini squats. You would make sure your knee does not go past 90-degree flexion. You would do this 10 reps for about 3 sets. And if you wanted to add a little bit more resistance and you had a resistance band available to you, you would put the resistance band just on mid-thigh and do the same thing, 10 reps, 3 sets. Make sure your knee doesn't go past 90.
So another one of these exercises that will be used during rehabilitation of a hip labral tear is called the bridge, which is going to work the pelvic floor and also the core. So what you want to do is lie down like this, as so. Lay down with your lumbar spine on the ground. You're gonna hold your hips, put your feet together, and you're gonna slowly go up, activating that core and the pelvis. Down, up, down. You could do that 10 times, 3 sets. And if you wanna work on the adductors too, you could also put a ball in between and squeeze them together as you go up and down.